Welcome. Today we're going to demystify a pretty complex medical condition, congenital vascular malformations. We're going to break down what they are, how they actually form, and the incredible modern approaches to managing them. So let's just jump right in.
Okay, so first things first, we have to clear up a major point of confusion. You see, these malformations are so often mistaken for something that's way more common, the infantile hemangioma. But I'm telling you, they are fundamentally different beasts.
This table really cuts right to the heart of it. A hemangioma, that's actually a type of vascular tumor. It usually pops up after birth, grows like crazy for a little while, and then it often just goes away on its own. A congenital vascular malformation, or CVM, is a whole different story. It's a structural problem that you're born with, it grows right along with you, and it never ever disappears on its own. Getting this distinction right from the get-go is absolutely critical because it changes everything about diagnosis and treatment.
So let's put it simply. A CVM is not a growth in the way we usually think of one. It's the result of what our source material calls arrested development during embryogenesis. It's kind of like finding a mistake in the original blueprints for the body's plumbing system. The defect was literally built in from the very beginning.
And to really get what makes each CVM so unique, we have to go all the way back to the beginning. The very beginning, to the embryonic stage. The exact moment that the developmental process for these vessels got interrupted, that moment defines everything about how the malformation is going to behave.
And this brings us to a really key framework that clinicians use called the Hamburg classification. It's a clever system that basically divides CVMs into two main types based on when that developmental hiccup happened, either early on or later in the process.
So extratruncular lesions, these are the result of an early stage error. And because they're less developed, they hold on to some of their embryonic qualities. What does that mean? Well, it means they have the potential to grow and spread when they're stimulated, by things like the hormonal changes of puberty or pregnancy or even from an injury. It also means there's a high risk of them coming back after treatment if you're not careful.
Now, on the flip side, you have truncular lesions. These happen when development stops later, as the major trunks of the vascular system are forming. So the good news is, these are more stable. They won't grow back. But, and this is a big but, because they affect the body's main pipelines, they can cause much more serious problems with blood circulation, what doctors call hemodynamic issues.
So how in the world do doctors figure all this out? Well, since CVMs can be incredibly complex and are often hidden deep inside the body, figuring out their full extent is a huge, critical first step.
The source material uses this perfect analogy. It talks about the tip of the iceberg. And that just nails the central challenge of diagnosis, doesn't it? What you can see on the skin might just be a tiny clue to a much bigger and more extensive malformation that's hidden away in muscle, bone, or other deep tissues.
The diagnostic journey really follows this logical step-by-step process. It all kicks off with a careful physical exam. From there, doctors use non-invasive imaging to start mapping out that hidden part of the iceberg. And then finally, the more invasive studies, like an arteriography, are usually saved for the final stages, when they're getting ready to plan a specific treatment.
And when it comes to the imaging part, there's a clear winner for a lot of these cases. For venous malformations, in particular, a special kind of scan called a T2-weighted MRI is considered the absolute gold standard. It just gives doctors the most complete and detailed picture of what they're dealing with.
All right, let's talk treatment. Because the way these conditions are managed today has gone through a massive shift. We've moved so far away from some of the old and, frankly, often ineffective methods.
This right here highlights a huge evolution. The old way was often just over-aggressive surgery, which a lot of the times led to really poor outcomes. Today, it's a completely different ballgame. The standard of care is a collaborative team of specialists who come together to create a totally unique plan for every single patient.
And this is what multidisciplinary really looks like in practice. It's not just one doctor making all the calls. It is a round-table decision. You've got vascular surgeons, interventional radiologists, dermatologists, even physical therapists, all bringing their expertise to the table.
So modern treatment really rests on two main pillars. On one side, you've got endovascular therapy, which is amazing. It works from inside the blood vessels, using special agents to block them off. Then you have surgical therapy, the more direct approach of actually removing the lesion. But here's the most important part. These aren't competing options. They are at their absolute most powerful when they're used together.
And that right there is the essence of the modern playbook. It's all about synergy. Using endovascular therapy before an operation can actually shrink a lesion, which makes the surgery safer and easier. And using it after surgery can help clean up any little bits that were left behind, which dramatically improves the long-term outcome.
And finally, this is so important to understand. For many patients, especially those with the extratruncular type of CVM, this is a lifelong journey. Management doesn't just stop after one procedure.
This slide really drives home just how dynamic these conditions are. A CVM can just sit there, totally dormant or quiet for years. But then, major life events, like the huge hormonal shifts during puberty and pregnancy, or even a physical injury, can act like a trigger, waking up a dormant lesion and causing it to become active and grow.
Which brings us to a really critical takeaway. Vigilance is everything. Because these conditions can change and evolve over a person's lifetime, the source material makes it crystal clear that regular, long-term follow-up isn't just a good idea, it's absolutely necessary for proper care.
And that leaves us with this final thought to ponder. It's a powerful reminder that managing the clinical side of the malformation is only one part of the picture. Supporting the person, the human being, through their lifelong journey with the condition, well, that's every bit as vital.